Welcome back. It is Tuesday. Of course, our Two Works For You dentist, Dr. Kevin Winters, in here to answer your dental questions this midday. Let's go ahead and get started. Hannah asks, I have noticed my gums bleeding sometimes when I brush my teeth. Is this normal?
Is it normal? You know, it's surprising, but we get that question a lot. And so let me ask you a question. If you were to rub on your arm with your finger and your arm started bleeding, it might be concerning. So it's the same thing with your gums. Gums don't normally bleed. If they do, they're telling you that there's a problem there. And that problem is related to gum disease. You hear a lot about gingivitis on TV with Listerine commercials and things like that. That's the beginning stage of gum disease. But what we know is about 80+% of the population has some stage of gum disease. So bleeding is one of the early signs or symptoms of gum disease. So if you're having that, it's telling you that there's some underlying problems there that need to be addressed that your dentist or your dental hygienist can certainly handle for you. So if you're noticing that, be sure and contact them, let them know what's going on, and then they can have some suggestions for you.
All right. Up next, Ryan says, I have a lot of problems with my ears, pain, ringing, etc. My doctors say they look fine. Could something be wrong with my teeth or contributing to this? Yeah,
well, so it sounds like there would be a couple of possibilities that we'd look at. One that could have some effect would be if there's some infection around a tooth, if there's an abscess present on one of your back molar teeth. Probably unlikely, but that can be a consideration. The more obvious thing is something that's just right in front of your ear, and that's your jaw joint. And many times when your bite is having problems or things are kind of out of place as far as the balance of your jaw goes and how it relates to your skull, pressure can be applied to the ear canal, which sits right in front of. And so you can feel like you have an earache, ear congestion, ringing in your ears, things like that. And it's mistakenly thought that it's my ear when in actuality it's the position of the jaw joint and what's going on with the health of that jaw joint. So dentistry certainly can have a good impact and improvement upon that if that's the case.
I had that problem one time. I had a tooth built up, and it was a little too high.
Right.
Had to file down.
Yeah, absolutely, absolutely.
Next question, Kelsey says, my dentist wants me to replace a tooth that has been missing for years. It is in the back, though, where no one can see it. Why should I get it replaced?
Yeah, well, just the fact that it can't be seen isn't the deciding factor on whether that should be replaced or not. So here are some of the reasons to consider in that. One is when a tooth is no longer there, the teeth around that tend to move because they like to be supported by each other. And so all of a sudden one of the members is gone, then the teeth can drift, and as that tooth moves over the years, it can lose bone around it. Another thing, we were just talking about bites, it can change the balance of your bite and create muscle and jaw joint problems for you as well. So long term, the stability of that area, the bone health in the area, and the stability of the teeth around it can be greatly affected. So if you have the opportunity to replace a missing tooth, it's far better to do so.
All right. Thank you very much, Dr. Kevin Winters, stopping by today. If you have a question for Dr. Winters, be sure to post it to our KJRH TV Facebook page. Toss it over to Kirsten and Tanaya.